Hi everyone, my name is Raj Desi. My group and I are going to be doing a teaching plan today on HIV in the Aboriginal community. I'll start off by giving you an overview about HIV and some stats regarding HIV. HIV stands for Human Immunodeficiency Virus. This is a chronic disease which damages the immune system. One can be born with HIV due to the mother passing HIV to the baby during pregnancy, birth, or through breastfeeding. Therefore, HIV is transmitted through direct contact of blood and body fluid of someone who is infected with the virus. HIV can be spread through sharing of needles, eyedroppers, blood transfusions, organ transplants, and sexual contact. HIV starts with acute HIV infections, which leads to chronic HIV infections, leads to AIDS. There are 3 stages of HIV. So stage 1 is acute HIV infection. It's a sudden onset of symptoms, and it includes flu-like symptoms such as headaches and fever. The virus infects the CD4 cells. Stage 2 is chronic HIV infection, which is when you're living with the infections. HIV continues to multiply in your body, but very slowly. Stage 3 is what's known as AIDS. It's the final and most severe stage of HIV infection. Because HIV has damaged the immune system, the body cannot fight the infection. And AIDS stands, and I'll give you a bit of overview what AIDS stands for. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS caused by HIV virus. Therefore, AIDS is an acquired infection and the person is not born with the infection. So according to Stats Canada, I'll share some numbers with you guys that talks about HIV among Aboriginal people. So injection use remains the main route of HIV transmission among Aboriginal people. HIV has a significant impact on Aboriginal females. Between 1998 and 2012, nearly half, almost around 47.3% of all positive HIV tests reports among Aboriginal people were females. Likewise, almost 1/3, around 31.6% of the positive HIV test reports from 1998 to 2012 among Aboriginal people were youth aged 15 to 29 years old.
Hi everybody, I'm Amin. So I'm going to be talking about the social determinants of health that affect the Aboriginal community. So the first one that we have chosen to speak about is education. So residential schools have left a catastrophic impact on the health of students and later generations as well. Residential schools cause traumatic experience such as disruptive behavior passed on from students to their kids. In relation to residential schools, there was a lack of knowledge to the students, and majority of their learning was focused on Western culture. Many faced traumatic experience such as consequences of emotional, physical, sexual, and mental abuse, leading to inadequate education being obtained. A lack of education and awareness contributes to the prevalence and incidence of HIV infection. In addition, lack of education has also led to a lack of unemployment, leading to poverty. Therefore, the second social determinant that we have chosen is going to be poverty. The roots of poverty of Aboriginal people can be traced back to the forced relocation of Aboriginal people on land called reserves. Poverty results in the lack of resources because they are living in rural communities. They are underdeveloped, they have poor infrastructure, and they have a lack of clean water and a lack of resources to access. This includes grocery stores, poor access to healthcare, and unsafe roads. These factors result in many Aboriginals becoming homeless and forcing them to find ways to cope and survive. For example, living in poverty, there's such high rates of substance abuse and becoming sex trade workers. Under these circumstances, many women are in sex trade to provide food and shelter for their family as a form of survival and for themselves. The third social determinant of health that we're going to be talking about is physical environments. Poor quality housing and homelessness contributes to the prevalence of disease within the Aboriginal community. Housing is necessary to an individual in order to live and maintain a healthy lifestyle and be free from disease and illness. Additionally, living in an unsafe home that is unaffordable increases the risk of health problems, including HIV. Housing plays an important role in influencing the health of Aboriginal people in Canada. Aboriginal people are living in overcrowding housing, and it is a constant issue that they are facing. Overcrowding housing can lead to the spread of infection and disease or worsening of symptoms. The population living in poor housing causes stress to the individual, and they are forced to cope with these stressors through negative poor choices such as substance abuse and alcohol, which increases their risk to HIV.
Hi, I'm Rajvinder, and now I'll be talking about the programs for HIV. So, Vancouver Native Health Society is the first one. It's established in Vancouver. It promotes physical, mental, and spiritual health of Aboriginal people. This includes Aboriginal people living with HIV. The Positive Outlook program provides social and medical support to HIV patients that live in the downtown east side. They also have a self-management support and peer support program, which helps individuals live with their illness. The challenges include that this program is open to non-Aboriginal people, which causes Aboriginals hesitant to seek the treatment. The second program is Peers Alliance, which stands for Prevent, Educate, Empower, Respect, and Support. It supports those with HIV, individuals at risk for HIV, and all sexually transmitted infections. They offer free condoms, lubricant, and safer sex resources. The nutrition program offers access to fresh local food for those living with HIV, and they provide personal hygiene products. The Total Outright program for 18 to 29-year-olds help individuals who are gay or bisexual and teaches them to educate about safer sex practices. This program happens in Nova Scotia and includes all accommodation and food. The challenges include people who don't live near Charlottetown would have a difficult time accessing this program. This outright program is online for 18 to 29-year-olds, and if you're older, you cannot take part in this program.
Hi, my name is Sukhwinder Sandhu, and part of our teaching plan, I'm going to talk about the impacts of colonialism and how this process has contributed to the incident of the issue that we have chosen, which is HIV. So Indigenous people are identified as a population group that experience poor social determinants of healthy and colonialism and racism, which increases the exposure to HIV. So Aboriginal people have been marginalized and exploited since the colonial age. These people have been suffering emotionally and physically as their relationship with Canada has left them with high social concerns. Additionally, colonialism has led to Aboriginal people to have a mistrust with the Canadian healthcare system, which in turn leads to added lack of education, which also can lead to poor sexual choices, for example, the use of condoms and sharing of injections. For those who want to seek treatment, many women face fear of judgment and discrimination by the healthcare system. Therefore, they are seeking for medical help when it was too late and the HIV progressed, and therefore distrust in healthcare services leads to mistrust among the Aboriginals, leading to poor health outcomes. Canada has stripped them of their culture, society, and any economic stance, such as fishing and hunting, which was a vital part of them to maintain a healthy lifestyle, such as diet and providing for their family. Aboriginal people relied on natural resources such as farming, fishing to provide for their families and communities. Before the Europeans colonized the Aboriginal people, Indigenous people knew how to live a healthy life by using herbal practices, and colonization stripped their practice away. Therefore, this results in high prevalences of HIV in rural areas, as Aboriginal people being forced to live on reserves. Since colonization by the Europeans, the Indigenous community has experienced serious physical, emotional, and spiritual health. This is depicted through the health challenges they face right now, such as the depression, suicide, substance abuse, and poor sexual choices that they make. Thank you.
So the section that I'm going to talk about is the recommendations for change. So for some of the recommendations, we were saying that we could reconstruct the living standards, such as rebuilding homes, providing adequate land where they can use this land as their main purpose for diet and traditional healing, as well as for farming food. We can provide access to services that are culturally appropriate for Aboriginal peoples and their needs, such as peer support works that are from their cultural background and can understand exactly what their concerns and what their issues are. We can increase promotion and prevention, have more women's shelters for the Aboriginal women that are in need. We can have safe injection sites throughout the community as well. Access to healthcare is far from racism, which respects their cultural values and beliefs. Ensure that Aboriginals are well equipped for services where they can access care without being judged or discriminated against, and they should feel safe when accessing healthcare. We can also have community workshops and conferences that discuss their cultural practices. We can all play a part in reducing the stigma and the discrimination that takes place against their culture and against their people, and end the mistrust and the unfair treatment of the Aboriginal community. So that is some of the recommendations for our teaching plan. And as psychiatric nurses, we can attempt to help address the issue by working together. There are multiple factors that contribute to the incidence to any one disease, and as long as we can address a couple of the contributing factors and be able to change certain risk factors, maybe and possibly we can help decrease the prevalence of HIV amongst Aboriginal peoples. So thank you for listening to our report on HIV, and we hope that you enjoyed what we had to say. Thanks.